The PAD III Observational Study is a prospective, core lab adjudicated, real world study investigating the use of intravascular lithotripsy across multiple vessel beds. The overall study plans to enroll a total of up to 1,500 patients. This interim analysis of 752 patients provides evidence across these different vascular beds with regards to the safety and efficacy of intravascular lithotripsy, and is an important interim analysis of this overall cohort of patients. The baseline characteristics of the PAD III observational study closely mimic the patients that I see in real-world practice. This includes patients with severe calcification in the iliac, superficial femoral artery, popliteal, and infrapopliteal arteries. Importantly, the overall characteristics of these patients included a very high prevalence of diabetes, with more than half of patients having diabetes, and a third of patients in this cohort had critical limb ischemia. And consistent with that, there was a very high prevalence of CTOs, as well as severe calcification, and a subset of patients with very long lesions as well. So to the extent that this is a real-world study, I think it very closely mimics what we see in everyday practice. So one aspect of the results that really stands out is the overall consistency of the efficacy of intravascular lithotripsy across all of the vessel beds that have been studied in the observational study. This includes excellent reduction in luminal stenosis in the iliac, SFA, and below knee vessels. And consistent with that, on the safety side, the risk of embolization or perforation or dissection is extremely low and consistent across all of these vessel beds. Interestingly, in some of the sub-analyses we looked at with this interim analysis, there was consistent efficacy even across some of the even more complex lesions, including long CTOs, as well as treating eccentric calcification. So I think these data really speak to the fact that when intravascular lithotripsy is applied to the treatment of calcified lesions, you can be confident that you're getting an excellent and consistent efficacy with regards to the reduction in the luminal stenosis with extremely low rates of angiographic complications. So intravascular lithotripsy has become a very important part of my overall practice and treatment with patients with peripheral artery disease. This, of course, depends on the vessel bed that is being treated, but I've used intravascular lithotripsy initially in my practice for application to superficial femoral artery and popliteal heavily calcified disease. But increasingly, I have utilized intravascular lithotripsy on a regular basis for treatment of heavily calcified common femoral disease, for treatment of iliac disease, especially in cases of difficult access for large sheath procedures. And I think that intravascular lithotripsy has a very important place in the treatment of infrapopliteal disease, as we know that calcium is more prevalent as you treat below the knee arteries, and we have limited other therapeutic bailout options in this vessel segment. I think one of the most important things to remember with this interim analysis is that this is one of the largest studies that has been performed in peripheral artery disease, regardless of the therapeutic modality. And I think that the close study of intravascular lithotripsy in a prospective manner with core lab adjudication really provides a wealth of evidence that then can be used to look at the advantages and efficacy of using intravascular lithotripsy across multiple vessel beds.